Northside ISD COVID-19 Safety Training 2020-2021. The safety and well-being of all staff and visitors are a priority for Northside ISD as the district begins to shift from working at home to working back in buildings. Various changes in the way the workplace looks, as well as new practices and protocols, have been implemented to follow recommended safety guidelines. Training objectives: COVID-19 basics, prevention strategies, infection control and illness prevention education for students, hand sanitizer recommendations, face mask procedures, personal protective equipment, PPE, health screenings, and isolation procedures. COVID-19 symptoms. Infection with COVID-19 can cause illness ranging from mild to severe and in some cases can be fatal. Based on what is currently known, symptoms may appear 2 to 14 days after exposure to the virus. Symptoms of COVID-19 typically include cough, shortness of breath or difficulty breathing, chills or repeated shaking with chills, fever above 100 degrees Fahrenheit, muscle pain, sore throat, and in some cases, a loss of taste or smell. In some cases, infected persons have no signs or symptoms and are referred to as asymptomatic. While most cases have been among adults, symptoms of COVID-19 in children are like symptoms in adults. Symptoms of COVID-19 in children typically include cold-like symptoms, such as fever, runny nose and cough. Vomiting and diarrhea have also been reported. The virus that causes COVID-19 is thought to spread from person to person through respiratory droplets when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled in the lungs. Spread of the virus is more likely when people are in close contact for an extended period. People are thought to be contagious up to 2 days before symptoms begin, and are most contagious when they are actively sick. It may be possible to become infected with COVID-19 by touching a surface that has the virus on it, and then touching your mouth or nose. But this is not thought to be the primary way the virus spreads. The Centers for Disease Control and Prevention, CDC website, provides the latest information about COVID-19 transmission. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. Practice social distancing by maintaining a distance approximately 6 feet or 2 meters from others when possible. Wear a face mask when in public. We must all work together in implementing these safety practices to protect ourselves and those around us. Illness prevention education resources for students. The CDC has many resources that can be used to teach students and fellow staff members the best way to prevent illnesses, including COVID-19. Hand washing, cough and sneeze etiquette. K-12 CDC Educational Toolkit includes posters, social media pieces, and videos. Resources geared for secondary students. Schools need to provide illness prevention education to students and staff members at the start of school and very regularly thereafter. Topics will include hand washing, cough and sneeze etiquette, what appropriate social distancing is, the proper use of face coverings, etc. Education must also be provided to new students upon enrollment. Hand sanitizer. All central office and campus buildings will be provided with hand sanitizer stations and hand sanitizer bottles. Hand sanitizer stations are to be placed at entry points, and sanitizer bottles will be in each campus classroom. Students and staff are required to wash their hands and/or use hand sanitizer upon entry to the buildings and several times throughout the day. Hand sanitizer safety considerations for students. Location. Keep away from young children when adult not present and not directly assisting in dispensing. Eye safety. Do not position or dispense sanitizer close to eye level. Cleaning protocols. Enhanced cleaning protocol. Regular cleaning practices have been enhanced, including service and routine cleaning and disinfecting of work surfaces, and areas in the work environment, including restrooms, break rooms, and meeting rooms. Frequent cleaning and disinfecting will be conducted in areas with high-touch surfaces. In accordance with CDC guidance, water fountains are discouraged from being used. NISD custodians will also clean public spaces such as building lobbies and restrooms on an hourly basis, and more frequently if deemed necessary. There are 5 modes of cleaning which apply to various circumstances: service cleaning, routine cleaning, supplemental cleaning, personal area cleaning, emergency cleaning. Service cleaning, performed before and during the hours of the instructional day. Service cleaning includes hourly cleaning and disinfecting of all student and staff restrooms, and cleaning and disinfecting of high-surface areas. Service cleaning also includes monitoring and maintaining services to athletics, fine arts, and other programs that require services every use. Sweeping of all floors, sanitizing of cafeteria tables, emptying trash, and other building-based tasks. Routine cleaning. Routine cleaning is performed after hours on a regularly scheduled basis by district custodial staff assigned to that building or area. Routine cleaning includes daily cleaning and disinfecting of all restrooms, sweeping and mopping of all floors, sanitizing of cafeteria tables, emptying trash, and other building-based tasks. Routine high-touch cleaning. Restroom stalls and dispensers, cafeteria tables, toilets, sinks, and faucets, food preparation surfaces, drinking fountains, door handles and knobs, including exterior doors, elevator buttons, handrails, recreation equipment, vending machines, countertops, light switches, copier, printer, and fax control buttons, front desk and lobby services. Supplemental cleaning. Supplemental cleaning performed by regular custodial staff to help perform service cleaning. Supplemental cleaning is focused on cleaning and disinfecting high-touch surfaces during the day, specifically for the purpose of preventing spread of disease and to allow custodial staff time to service vacant classrooms or perform other custodial duties. Cleaning and disinfection. Clean and disinfect frequently touched surfaces, for example, playground equipment, door handles, sink handles, drinking fountains, within the school and on school buses at least daily or between use, as much as possible. Use of shared objects, for example, gym or physical education equipment, art supplies, toys, games, should be limited when possible or cleaned between every use. If transport vehicles, for example, buses, minibuses, and white fleet vehicles, are used by the school, drivers should practice all safety actions and protocols as indicated for other staff. For example, hand hygiene, cloth face coverings. If more than one person is in the vehicle, spread out if possible. Develop a schedule for increased routine cleaning and disinfection. Ensure safe and correct use and storage of cleaning and disinfection products. Cleaning products should not be used near children and staff. Use only district-approved products. Personal area cleaning. Personal area cleaning performed by all employees in their personal workspace, which may include their desk, telephone, keyboard, chair, or any other items they use in performing their duties. This cleaning is customized to personal preference and standards and is done using district-supplied cleaning products and equipment. Receptionists and secretaries may be required to clean high-touch surface areas in their areas after every use. Personal area cleaning requirements. Personal area cleaning includes desks, computer keyboards and mouse, phones, chair arms, remote controls, cabinet and file drawer handles, microwave, refrigerator appliances, coffee machines. Emergency cleaning. Emergency cleaning is performed by the custodial team on an emergency basis in response to a particular identified incidence of disease. Cleaning agent safety. Rejuvenol, district-approved disinfectant, must be diluted. Consult with custodial staff. Spray on hard surfaces. Requires 10-minute drying time. Allow to remain wet for 10 minutes and then let air dry for best results. Frequently spray door handle areas. Leave classroom doors open to reduce multiple people touching the door. EvaClean Pure Tabs. Dissolvable tablets. Proteus sprayer, utilized by custodial staff. Classrooms and common areas must be empty when using EvaClean Pure Tabs due to bleach-like odor. Face mask procedures. CDC guidance requires that people should wear face masks in public settings to reduce the spread of COVID-19, where other social distancing measures are difficult to maintain. Everyone, employees, students, parents, visitors, vendors, etc., approved to enter a district facility will be required to wear a face mask in public areas and shared spaces such as workrooms, reception areas, break rooms, and public restrooms. Additionally, masks must be worn in face-to-face meetings where multiple employees spend time or where social distancing cannot be sustained. Working alone in an office area does not require wearing a mask unless social distancing cannot be sustained when someone enters your space. Personal face masks must adhere to the following guidelines. Must cover the nose and mouth to maintain effectiveness. Must be secured to minimize the need to adjust frequently. Must be appropriate for school, non-offensive, not considered derogatory or otherwise disrespectful to team members or visitors, and be professionally appropriate as outlined in the district's dress code policy. Should not be loose material that could get caught in machinery or cause injury. Do not need to be medical grade. Employees and students are required to wear their own personal face masks. If needed, the campus will provide face masks to students. Employees should notify their supervisor if they need a face mask before they return to the building. Face shields can also be used in conjunction with face masks. When within 6 feet of others, face masks should be worn. It is important that you remove your face mask correctly, and that you remember to wash your hands after touching a used face covering. Cloth face coverings should be washed after each use. The attached links to the CDC website contain information explaining how to safely handle a used face mask and how to appropriately wash cloth face masks. Personal protective equipment, PPE. Staff members will utilize appropriate personal protective equipment, PPE, when in close contact with an individual exhibiting symptoms of COVID-19 and or at risk of coming into contact with blood, bodily fluids, secretions or excretions. There are several types of PPE, to include masks, face shields, gloves, eye protection, and clothes protection, smocks or gowns. PPE is provided by the district and can be ordered from the purchasing warehouse via each building's representative. Health screening requirements for students. All students and parents must complete the NISD Student Screening Questionnaire once a week, Monday, before they come to school. This tool screens for any new or worsening signs or symptoms of COVID-19. Symptoms of COVID-19 include cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, loss of taste or smell, nausea, vomiting, diarrhea, feeling feverish or a measured temperature greater than or equal to 100 degrees Fahrenheit, known close contact with a person who is lab confirmed to have COVID-19. Health screening requirements. Staff. Staff members must self-screen for symptoms of COVID-19 each day. Prior to or upon arrival to work, utilizing the Health Screening Questionnaire, HSQ. This can be done electronically utilizing a QR code or via paper questionnaires provided at the campus. Staff members will also need to check their temperature each morning, which can be done at home or upon arrival to work. Isolation procedures. Any student or staff member presenting with a temperature greater than or equal to 100 degrees Fahrenheit or other symptoms of COVID-19 will be immediately isolated from others and sent home. Each campus must adhere to a protocol for isolation and discharge of students who become sick during the school day. Appropriate staff members will be identified by campus administration to serve as the isolation team. Specific rooms must be maintained for students or staff with COVID-19 symptoms that are separate from the nurse's office or other space where other ailments are treated. The plan for isolation rooms must be included in the campus emergency plan. And all staff must be trained on protocol to follow when a student or staff member is experiencing symptoms of COVID-19. Communication plans must also be put into place at each campus to alert the school nurse of a student or staff member, requiring assessment and possible isolation while maintaining privacy standards. Immediate communication prior to moving the individual is needed to ensure the safety of other students and staff, if relocation is required to enact the isolation procedure. Ill student pickup procedure. The parent or guardian will be contacted to immediately pick up student. Campus procedure choice. Parent or other designated emergency contact may follow protocol of walking in, showing ID, signs out student, and student is released. Or parent contacts office that they have arrived and remains in the car. Nurse or other isolation room designee walks student to car, confirms parent ID, and releases student. Designee signs student out to indicate to whom the student was released based on emergency card and ID check, and initials the sign-out sheet. Parent education. The parent or guardian who picks up a child experiencing symptoms of COVID-19 will be provided a health services brochure with guidance on monitoring the student, contacting their medical provider, and when the student may be allowed to return to school. Illness prevention signage procedure. Signage standards help ensure the integrity of messaging across all NISD sites through use of common language and visuals to communicate our health and safety standards. District-approved signs and posters will be used as standard signage in NISD schools and facilities. Some signage will be provided. Some will be printed by the campus if needed. Additional signage may be purchased through NISD printing services. COVID-19 information resources. The Center for Disease Control and Prevention, CDC. San Antonio Metropolitan Health District, SAMHD.